Okay, we are back with another episode for Heroes of HR podcast. We are live at iSolve Connect in Scottsdale. Beautiful Scottsdale, by the way. Okay, so you are from where?
Philadelphia, Mississippi.
I'm from Philadelphia, Pennsylvania.
How about that?
I'm going to assume Philadelphia, Mississippi is nicer than Philadelphia, Pennsylvania.
Depends.
No, maybe.
Person.
Okay, well, same idea. iSolve was in Philadelphia, PA last week.
Right.
And we were there, and I got to be there. It's the first event that I've ever done in my hometown in 20 years.
Oh, that's nice.
Which was great because I had to travel. I still stayed over though. I took advantage and I stayed over. But everyone's like, "Where do we go?" And look, nowhere. You just stay here. You're good. Just stay right here in the casino and you'll be totally fine. So, okay. Before we kick off, do me a favor. Introduce yourself to the audience and tell us what you do.
My name is Arenthia Kirkland. I'm the HR manager for East Central Mississippi Healthcare. We have approximately 75 employees. It's community health centers, and we actually have 4 locations. The main site is in Sebastopol, Mississippi. We have one location actually in my hometown, Philadelphia. We're a group of clinics.
Okay.
We have another site in Philadelphia, another site in Walnut Grove.
Okay.
And again, to my rural
You say Water Grove or Willow Grove?
Walnut Grove.
Oh, Walnut Grove. Okay. Because we have a Willow Grove. I think we're getting too close here. We're
All right.
Too close.
And then another location in Newton, Mississippi.
Okay. Okay.
Philadelphia is about an hour and a half from Jackson, Mississippi, the capital.
Got it. Okay. Yeah, I got it. Okay. So community health centers. That's what we're working with, right?
Yes.
Okay. So how does HR in your mind, how does HR differ in a community center versus a large organization?
Let's see. I've been working with this group for 8 years. Prior to my coming there, they didn't have a true HR person. So the responsibilities, from what I understand, were divided up between the finance assistant and the finance manager, and sometimes the actual executive director.
Got it.
So someone to actually handle employee issues. A long time back was with the director of the company. And so in a smaller setting, let's see.
It's just a lot.
I'm a department of one. Basically.
Right. So I'll say, yeah.
So I do I do employee relations, I do payroll, I do benefits. I'm actually the compliance officer.
Goodness. And how many?
Credentialing and privileging for our providers and our support staff.
Jesus.
So I wear a lot of hats.
Yeah. How many employees do you guys have?
About 75.
Okay, so 75, and you're the only person. That sounds like a nightmare.
Not really. iSolve makes it easy.
I'll say it sounds like an actual, because it's funny because the podcast called Heroes of HR. And we're
Think
talking.
I'm a hero?
Yeah, I honestly, at 75 people managing yourself, yeah, I do. So let me ask you this. I want you to finish this sentence. Being a people hero needs.
I feel like being a people hero means, being accessible to your employees. People have many needs. It goes well beyond a person coming to work every day, because people come to work with issues, problems, and they're not always work related, And sometimes you find yourself going into counseling mode for employees. Not that you sign up for that, but you just find yourself in that in that position. A hero, I feel like a hero is, again, being able to be accessible to the employees. If they have needs or they have questions or concerns, and I feel like you're rewarded being able to help someone.
Yeah.
And I often find myself, I'll tell employees if they thank me, my pleasure. It's a pleasure to be able to help someone.
Yeah.
You know what? Yeah. It's a gift to be able to help someone.
You
never know what someone's needs are.
Yeah, it's interesting you say that because people come to work with problems.
Yes.
That you don't know about. You don't know if someone's having a great day or a bad day. Just because they're smiling.
True.
Doesn't really mean you're having a great day. And so it's important, especially as a department of one, with all of those people. And you're in the community, so you're serving the community.
Yes.
Right? And so you need to have employees that are there mentally, physically, emotionally, and that falls on you to
have employees to be their best self. And again, not everybody's going to come to work at their best self. I may not always be at my best self. I want to present my best self as much as possible.
Yeah, yeah.
But in being an HR person, you're going to be confronted with things, and sometimes that may be the very day you're not having a good day.
Right.
But still, you have to put on your HR hat and put those issues aside and be accessible to the needs of the people.
Right. I've always looked at HR as a job I would never want, but I always loved. 'Cause we've been studying HR for years, and I got to tell you, we talk to people of all different types, right?
Right.
Whether it's HR, it could be payroll, benefits, hiring managers across retail chains and whatever hospitality. Like
Right.
we're all so very different. But when we have our conversations with HR professionals, there's an inherent love of people, I feel like, right? Like they actually care. And I think it's one of the only jobs outside of radio that we found that always has to be on. Like you can't have a bad day at HR, or at least you can't show that you're having a bad day.
I have to agree. I totally agree with
Yeah.
you. Again, you really can't. It's hard to have a bad day. I don't know. Sometimes I may be having that bad day, but somehow something is going to happen. Something's going to transpire in the day to help make it better.
Right.
And if I can be that change agent, I'm there for it.
Yeah.
I'm there for it.
Yeah.
I really am.
Yeah. Yeah. I remember as you're talking, excuse me, as you're talking, I was thinking for whatever reason, when I said retail and then you were saying something, I remember we used to be called the personnel department.
Yes.
Right. And it's like,
I'm at the age where I remember that.
yeah. And I'm like, it's just so funny because we interview people, so many people, different, ages. And it's like, yeah, it used to be called the personnel department. They're like, well, what is that? I'm like,
Right.
You're obviously just starting out in HR. You have a seat didn't always have a seat at the table, right? Like you weren't
I
always
agree.
part of the business. But one of the areas I think that hasn't, well, I shouldn't say hasn't, it's changed over the years was the employee experience. And how do you make that experience for the employees better every day?
I feel like having the open door policy, and I know that's probably a cliche, but employees, if they know they can count on human resources to be able to come in and talk to them or bring issues to the table, because so many times employees say, you know what, there's no need to bring this to your attention because nothing's ever going to change.
Right.
And I always, if I hear that, I say, you know what, if we don't know about a thing, there's nothing we can do to try to help possibly make it change or attempt to make things better or make those improvements. So if you're not willing to have the conversations with human resources or management, if we don't know about those things, then we can't do anything about them.
There's no
Certainly,
God.
and I had this conversation with someone not too long ago. Give us the opportunity.
Right.
Give us the opportunity. Don't just walk out the door or decide you're going to leave and hadn't talked to us.
Right.
Help us help you.
Yeah. Yeah. This is probably way over dramatizing this. I've always looked at HR as like, say a nurse, not a doctor, a nurse or a doctor. Like your bedside manner has to be direct and to the point, but also caring and understanding and loving, right? Like if you're in the hospital and you're dying of something, you have cancer. You don't want the doctor to come in and be like, well, there's a good chance. Is it like, I need to know the truth. And if HR has to have a hard conversation, you got to be able to say, sit down. We need to have an uncomfortable conversation. It's interesting because it's not always that way today with a lot of HR leaders.
Right.
It depends on the size company, I think. But I think the smaller the company, the more difficult it seems to be because you're more friendly. You know everybody in a company, right? You can't
It's community.
you can't just go cut 50 people because you actually know their families in some cases. And that's difficult. Final question, because I know you've got important things to do here and not just talk to me.
I'm enjoying talking to you.
We could talk all day.
Yeah.
What's I don't say hero story, but something that you've done or that you've seen in the organization where something was done, whether it's HR or from an employee to another employee that really impacted the life of that employee, whether it was professional or personal?
Oh, gosh.
That's a kind of a deep question.
That's a deep question. And we actually had a nurse. She had an illness that prevented her from actually doing direct patient care. So she moved into another role. She still was a nurse. ended up ultimately having to resign
Mm.
due to this medical condition. And even after she resigned, and the community there in Sebastopol,
Hmm.
they actually did a fundraiser because
Oh, good.
she needed a transplant.
Okay.
And so she was on the transplant list. And from what I understand, the community came out for even the company itself,
Hmm.
because she just lives right down the road from where the main
Right.
clinic, the main site is. And I saw community come out for her like never before. And she ultimately did receive a liver.
Oh, that's
She
wonderful.
received a liver, I mean, not long after she resigned.
Right.
And her benefits, because again, her main concern is that her benefits
Right.
after leaving employment stayed intact because everything
Sure.
was contingent upon that,
Hmm.
this care that she needed so badly. And to me, that was very rewarding in watching this individual not have to go through this suffering
Right.
quite naturally, but for community to step in for her. And this was one of our own and still is valued to this day. Um, I would have to say that story in particular. I'm sure that I have others, but
Yeah. Oh, it's a great story to end with. I love it. Well, thank you so much for joining us. I know you've got
pleasure.
important things to do here. Go learn. You don't need to talk to me all day.
This has been amazing.
Oh, I'm
Really
glad.
has been.
I'm glad you let me suck you into this and pull you in. I appreciate it. Thank you very much.
Thank you.